Welcome everyone. Today we are going to dive into the critical role of medical nutrition therapy across the entire spectrum of cancer care. We will explore how nutrition impacts cancer prevention, supports patients during active treatment, and aids in long term survivorship. Let's define what exactly we are dealing with. To start, cancer is essential group of diseases characterized by the abnormal and uncontrolled division of cells that have the ability to spread throughout the body. The landscape of cancer is changing. Some cancer can now be closely monitored and treated much like a chronic disease, while others remain highly aggressive and lead to early death. It is important to understand that the etiology of cancer is rarely simple. It is multifactorial, meaning genetic, environmental, medical, and lifestyle factors all interface to produce a given malignancy. Let's look at the overall impact of this disease. Cancer statistics and impact. The statistics surrounding cancer are staggering. Annually, in the United States, for example, cancer is responsible for almost 1 in 4 deaths. It sits as the second most common cause of death, right behind heart disease. And nutrition professionals, we must pay attention to that fact that an estimated 1/3 of anticipated cancer death can be directly attributed to nutrition and lifestyle behavior. This includes poor diet, physical inactivity, alcohol use, and overweight or obesity. Furthermore, the economic the economic burden is immense, costing over 216 billion annually in the United States alone. Let me discuss how we can actively prevent it. American Cancer Society provides robust guidelines for prevention. First and foremost, achieving and maintaining a healthy body weight is crucial. Individuals should aim to be as lean as possible throughout life without becoming underweight. Adopting a physically active lifestyle is also key, requiring at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous active each week. This is weekly. Dietary, the emphasis should be on plant sources, eating at least 2.5 cup of vegetables and fruits daily, while actively limiting processed and red meats. Let's understand the cellular beginnings of cancer. The pathophysiology, genetics, and cell growth. When we look at the pathophysiology, carcinogenesis is the origin or development of cancer. This process stems from changes in gene function that cause normal cell to transform into cancerous one. Two major gene types are involved: oncogenes, which are altered genes that promote tumor growth and inhibit programmed cell death, and the tumor suppressor genes, which normally protect the body but become deactivated in cancer cells. Interestingly, despite common misconception, only about 5% to 10% of all cancers occur as a result of inherited genetic alteration or mutations. The three phases of carcinogenesis. Carcinogenesis is multi-stage process that occurs in three distinct phases. Number one, initiation. It begins with initiation, which involve the rapid transformation of cancer produced by the interaction of chemicals, radiation, or viruses with cellular DNA. Second is a promotion, where these initiated cells multiply and escape the body's protective mechanisms, establishing an abnormal tissue mass known as neoplasm. Number three, the final phase is progression, where tumor cells aggregate into a fully malignant neoplasm. Eventually, the neoplasm develops the capacity for invasion, a process known as metastasis, spreading to distant tissue. Let's see where nutrition fits in. Nutrition and carcinogenesis. Nutrition is incredibly powerful because it may modify the carcinogenic process at any stage, whether that is during carcinogen metabolism, cellular defense, or tumor growth. In fact, up to one third of cancer in higher income countries are linked to poor nutrition, physical inactivity, and excess weight. In our diet, we have enhancers of carcinogenesis, such as saturated fats in red meats or polycystic aromatic hydrocarbons from high temperature grilling. Conversely, we have inhibitors like dietary antioxidants and phytochemicals that actively scavenge and neutralize free radicals. Let's discuss a specific dietary factor, the alcohol. The role of alcohol. Alcohol is highly modifiable risk factor in developed and non-Muslim countries. In consumption is responsible for millions of deaths globally and is associated with an increased risk for cancers of the oral cavity, esophagus, colon, liver, and breast, among others. For cancers like colorectal and stomach, consuming two or more drinks daily significantly increase your risk compared non-drinkers. It also detrimental of for those already diagnosed. Alcohol consumption is associated with increased overall mortality and lower survival rates in cancer survivors. If combined with tobacco use, the risk of upper digestive and respiratory cancers multiplies greatly. Let's look at body weight. Energy intake, body weight, and obesity. Obesity is a major risk factor and may account for up to 20% of all cancer related mortality. This makes maintaining a healthy weight the second most important lifestyle factors for reducing cancer risk right after smoking cessation. The physiological mechanism here involves body fat acting as metabolically active tissue. Excess fat produces estrogen and protein that elevate insulin and other hormones like insulin like growth factor 1 or IGF-1. High circulating IGF-1 act as a mitogen, encouraging cells to divide and are heavily associated with the prostate, with the breast, with lung, and colon cancers. Let's look at specific macronutrients. When we examine dietary fat, we must realize that high fat diets often contain more meat and calories, heavily contributing to obesity and thus increase cancer risk. The current, the current recommendations focus on limiting highly processed foods that are high in fat and added sugar, which naturally reduces trans and saturated fats in the diet. Speaking of sugar, high glycemic diet that repeatedly rise blood glucose uh, may increase cancer risk by systematically creating higher level of IGF-1 in the body. Sugar drinks and energy dense food easily promote weight gain, which is why their consumption should be strictly limited. Protein sources matter significantly. Experts found that eating just 50 grams of processed meat every day, about one hot dog, increases the risk of colorectal cancer by 18%. Processed meat contain nitrates used as preservatives, which can reduce which can reduce to nitrites and form carcinogenic nitrose compound in the body. Furthermore, charring charring red meat at high temperature, I mean, over an open flame produce polycyclic aromatic hydrocarbons and heterocyclic amines. For these reasons, major guidelines universally recommended limited limiting processed and red meats, encouraging a shift toward plant-based protein like legumes, like nuts, like seeds. Let's make advice to address common patient concerns regarding food quality. Patients frequently ask about organic and genetically modified foods. Current large studies show that consumption of organic food is not associated with a reduction in the incidence of cancer compared to conventionally grown food. Similarly, the National Academy of Science reviewed genetically modified crops and found They pose no unique hazards to human health regarding cancer. However, everyday chemical exposure is concern, likely causing an estimated 12% of cancer. One such chemicals is bisphenol A, BPA, and industrial chemicals in plastic. While the FDA currently states the health threats is lower than previously estimated, the over the, the overarching goal remains to reduce exposure to bisphenol A. Okay, chemoprevention. Chemoprevention is an exciting area of oncology. It is the use of drugs, vitamins, or other agents to reduce the risk or delay the development of cancer. Researchers are actively investigating natural molecules like polyphenols in fruits and vegetables, green tea, and curcumin. These compounds likely have complementary mechanisms, including antioxidant and immune modulating properties. As dietitian or a nutritionist, it is reasonable for us to recommend a health promoting diet rich in fruits, rich in vegetables, soy, and culinary herbs like turmeric and cinnamon for their chemopreventive potentials. Let's break down these phytochemicals. Phytochemicals in fruits and vegetables. Here is a look at the specific protective properties of color coded phytochemicals. Lycopene. Lycopene, red color, found in red foods like tomatoes, protect against prostate cancer. Anthocyanins, also in red and purple berries, prevents cancer formation and provide antioxidant support. Yellow and green foods contain lutein and zeaxanthin, which protect cellular DNA from damage. Cruciferous green vegetables contain sulforaphane and indoles that actually change DNA methylation to regulate cancer progression. Finally, allyl sulfide in white and green foods like garlic and onions protect against stomach and colorectal cancer. Let's look at a few other notably dietary components. Vitamin D, coffee, and tea. Vitamin D act as precursor to hormone calcitriol, which regulates multiple pathways involved in cell proliferation, apoptosis. When it comes to beverages, coffee contains various antioxidant and phenolic compounds. Despite containing acrylamide, regular coffee consumption is not associated with an increased risk of cancer in humans. Tea, particularly green tea, is an excellent source of phenols because green tea leaves are not roasted. They retain high levels of catechin, specifically the EGCG, which possesses strong anti-cancer biologic activity. The EGCG is the epigallocatechin. Soy and plant-based diet. There is a lot of confusion regarding soy, but the evidence is clear. Soy contains isoflavones, phytoestrogens means, that actually protect against breast cancer, especially if consumed early in life. The American Cancer Society states that consuming soy foods doesn't have an adverse effect on the recurrence or survival of breast cancer patients. Broadening, broadening out to dietary patterns, plant-based diet provide excellent anti-cancer properties. The Adventist Health Study 2 found that a vegan diet appeared to protect against cancer more than any other dietary pattern. This is largely because vegetarians typically consume higher level of fibers, which directly reduce colorectal cancer risk. What about physical activity? Physical activity is an indispensable pillar of cancer prevention and survivorship. Studies clearly show that increasing physical activity reduces the risk of developing breast, colon, endometrial, advanced prostate, and pancreatic cancers. It helps patients regain and maintain muscle, strength, and energy, while, while the symptoms also relieve the symptoms of stress. Furthermore, evidence reflect that exercising during after treatment is entirely safe and is associated with improved quality of life and positive outcomes. With medical clearance, cancer survivors in all phases should be as physically active as possible. Let's look at diagnosis. Medical diagnosis and early warning signs. Catching cancer early is critical. The American Cancer Society uses the acronym CAUTION. This is the acronym CAUTION to describe early warning signs. Change in bowel bladder habits. A sore that doesn't heal. Unusual bleeding or discharge. Thickening or lump in breast or elsewhere. Indigestion or difficulty in swallowing or chewing, obvious change in a wart or mole, nagging cough or hoarseness. When symptoms present, physicians establish a definitive diagnosis through a combination of physical examination, laboratory test, imaging procedure like CT or PET scan, and finally tissue biopsies. Let's review how we stage cancer one in its diagnosis. The stage of cancer at diagnosis is a strong predictor of survival and directs to oncologist treatment plan. The most commonly used system is the T and M staging system. T stand of for the size and extent the primary tumor. N indicates whether the cancer has spread to nearby lymph nodes, and M stands for metastasis, indicating whether the cancer has spread to distant organs. Ultimately, this translates into staging number from stage 1 being the least amount of disease to stage 4 representing advanced metastasis disease. Okay, now we are going to classify and discuss the common types. Cancers are broadly classified by their tissue of origin. Solid cancers are often referred to as tumors, while hematologic malignant diseases are frequently called blood cancers. Adult cancers frequently involve in the epithelial tissues that cover internal and external surfaces. These are known as carcinoma. Conversely, leukemias, lymphomas, and myelomas are cancers of the immune and lymphatic systems. It is also vital to note that some cancers are driven by infectious causes, such as hepatocellular carcinoma from hepatitis B virus or cervical cancers linked to the human papilloma virus HPV. The medical treatment modalities. Cancer is typically managed using a combination of conventional modalities. Chemotherapy uses chemical agents or medications to systematically treat cancer by interfering with synthesis of DNA and cell replication, while biotherapy uses biologic agent to produce anti-cancer effect by inducing, by enhancing, or suppressing the patient's own immune system. Hormonal therapy is a systematic treatment. Hormonal therapy is a systematic treatment for hormone sensitive cancer that blocks or reduces the sources of a hormone. Finally, radiation therapy uses high energy ionizing radiation in fractionated doses to treat localized cancerous tissue. Let's discuss the goals of these treatment. The medical goal of cancer treatment can be care, control, or palliate. When a care is not possible and the treatment no longer work, palliative care is offered. Palliative care is designed to relieve pain, to manage symptoms, and help individual be as comfortable as possible to promote quality of life. Hospice care is a specific type of palliation for individual with life expectancy of 6 months or less. In all stages of care, culture, cultural competency is critical. Healthcare providers must assess treatment preferences, end of life values, and dietary patterns to avoid cultural barriers that negatively affect care. In the next lecture, I will discuss the medical nutrition therapy for cancer. Thank you for your attention and goodbye.